Welcome back. Let's continue focusing on the vaccination. Phase 2, if you will, the second phase of the COVID-19 vaccine rollout is kicking off tomorrow around the country. It's the Gauteng Health Department that we're looking at for this half hour, expected to announce its plans. The province has officially been hit by a third wave. That announcement made on Friday. Let's find out where the department is with their planning and the rollout tomorrow. Always a pleasure speaking to the acting Chief Operations Officer. It's Nomsa Mope joining us from up here in Johannesburg. Hello to you, Nomsa. Thanks for your time. Let's first of all just talk about numbers, if we can. We'll get into logistics about tomorrow in a moment. How many registrations do we have for the vaccination program starting tomorrow? What's the numbers you have?
Good morning, Gareth. I think we just have just over 300,000 people that are over the age of 60 that have registered across the province. But we continue to register on a daily basis. Even today, most of our people in all the districts are continuing to register people at various points.
And as far as numbers for the available number of vaccinations, the actual jabs that will be available in the province, I know it's a very loaded question. Are you able to give me some kind of number to indicate where we are on the number of jabs available in Gauteng?
Yes, we were promised 61,600 jabs by the National Department of Health, but in our meeting with them on Friday, they indicated that they were going to give us 138,000 as the first batch, working towards the 61,600. And as I speak to you now, all the district's pharmacists have received their doses last night.
There were some issues, Nomsa, and I'm sure that you're aware of them. I think let's try and allay some fears for a moment about the registration process, this number that you SMS, you then get a confirmation SMS, you then get another SMS telling you when to go for your jab or something along those lines. But there seems to be a problem with the uptake of people registering on that platform. It seems it's difficult to do, especially for the elderly who perhaps aren't as tech savvy as some of the youngsters around. How do we get around that?
Yes, that's correct, Gareth. We did have some challenges with the system itself. Remember, the system is managed by the National Department of Health. So what we do is we're just given a link, and that link, we use it to go out to register people in the various areas. What we've done is that we have gotten the community health workers that are working in the districts to go out into the households and go and assist, especially those old people that are unable to register. We also have gotten local government municipalities. They've given us their brigades to come and increase the capacity for us to reach as many people as we can. However, the one part that's not often spoken about is the hesitancy that we also experience as and when we go about assisting people to register. In the old age homes in particular, some of our healthcare workers were not able to register some of the people that are in the residential areas because their families were saying consent must be gotten from them as family members and not from the old people. So those are some of the challenges that we get into. And for those that are not able to use the system, we have got people that go house to house, try to assist the older people to register. But even then, there are people that are still hesitant. Some are undecided. Others, the whole story of the blood clots just puts a lot of people off, and people are still trying to decide whether they want to continue or not continue with the vaccination campaign. But we have got a very big group of people going around the malls, the SASA points, in the homes, everywhere, in churches. We've also asked the traditional leaders and as the church leaders to also join the campaign to assist. I, for one, for an example, in my church where I go, I do go there with the link, and I've asked the older people to bring their IDs, and after church we queue, and I help to register them. That is done. That's one part. Registering is one part. Then the next thing that's supposed to happen is that a person has to receive an SMS to say that They congratulate them for registering on the link, and most people do get it, others don't get it. And then you also have other people that are really a disappointment because of being computer savvy or technology savvy. They bypass the system, and then they get into the queue and frustrate the people that are supposed to be there. But we've communicated very widely about it and discouraged people to allow the remainder of the healthcare workers, as well as those that are old and vulnerable, to be first in the queue. But there are glitches, but the National Department of Health is really working very, very hard on that to clear that. But where we can, Gareth, we've done our best. The numbers are gradually increasing, but not at the pace as we would like them to be.
Nomsa, let's talk, just before I say goodbye to you, it's such an important question. As briefly as you can, we've spoken about the registration process. There is going to be concern, I'm sure you'll agree, about the queuing tomorrow. It was less than 72 hours ago, Gauteng declared a major problem as far as the third wave is concerned. Now, 72 hours later, we're expecting people to stand in queues to get this vaccine. Of course, there is an irony there, but beyond that, how are we going to try and handle the overcrowding and the social distancing tomorrow, especially for older people who might be there with their families? It's difficult to control that. It's a last question to you.
Gareth, perhaps I need to clarify. Tomorrow, we are vaccinating the remainder of the healthcare workers in the old vaccination sites that were already established. Over and above that, we will be in old age homes to vaccinate the people that are in the old age homes. So we have made provision for people that are going to be walk-ins, because people do come even if they are not called for. So what we are appealing to the community is that please let's not go and clog the old age homes. We go into the old age homes and also in the facilities where we've been vaccinating to cater for the healthcare workers. That's what is going to happen tomorrow. It's not open to the general public. We are going to be phasing it in as and when we receive additional vaccines, because there's no point in people going to the vaccination sites when the vaccines are not adequate. Just now we'll be told that we are unable to vaccinate, we don't have a plan. Please, media, if you can help us. Tomorrow we are in the old age homes as well as the vaccination sites that have been existing to make up for the numbers of the healthcare workers that were not covered by the Sisonke program.
I appreciate your time in speaking to us, Nomsa. I think very, very important, that last answer about what is happening tomorrow. No doubts we will cut that part of the interview, put that online, and also bring it to viewers here on ENCA. Very important about that vaccination rollout tomorrow. It is not open to the public. We'll bring you those details later again. Now, still